Welcome back. The entire month of October is Breast Cancer Awareness Month, highlighting the importance of getting screened for breast cancer. The Centers for Disease Control says breast cancer is the most common form of cancer for women in the United States, aside from some skin cancers. In 2015, when the latest data was available, over 41,000 women died from breast cancer. Joining us now to talk about the importance of getting screened is Dr. Alyssa Abendroth with St. Peter's Health. Thanks so much for being with us.
You're welcome. Good morning.
So first off, just tell us a little bit about what you do at St. Peter's.
So I'm a general surgeon. We have 5 general surgeons at St. Pete's Health. 3 of us provide care for breast cancer.
And so when you hear some of those statistics that we just talked about, how concerning is that trend?
Well, when you think of it, 1 in 8 women will get breast cancer. So you think of a community the size of Helena and the communities that we provide care for at St. Pete's Health, that's about 85 to 90,000 people. So we have about 90 new breast cancers a year. And so 1 in 8 is a staggering number. Really important to be breast cancer aware and work on your screening.
Yeah, so let's talk about what should you do, when do you need to start getting screened, how often, those types of things.
So the gold standard for screening nationwide is mammography. At St. Pete's Health, we recommend at age 40 that women start their mammograms, and it should be yearly.
Yearly, perfect. And so what are you looking for in this exam?
Basically on mammography, it's an image of the breast tissue, and the radiologists, when they're reading the films, are looking for any new changes or abnormalities in that breast tissue.
And why is early detection so important with something like this?
Well, breast cancer, as well as other cancers, early detection is always very important. When you detect something at an early stage, it's much more curable.
And I understand there's some new technology that will be making its way to St. Peter's that might help give more detail in those exams.
Absolutely. 3D mammography has become what's going to become the gold standard for mammography. It's able to detect earlier breast cancers. It's able to look at dense breast tissue a lot differently than traditional mammography, and so we will be able to detect earlier breast cancers.
And is that just something that you would talk to your doctor about if you were interested in being able to utilize that?
Absolutely, absolutely.
Okay, perfect. And then, so is this, with like months like Breast Cancer Awareness Month in October, do you think, is awareness rising? Is there a better understanding that this is an issue that people should be looking out for?
Absolutely. When I think of my 15 years of being specifically a breast cancer surgeon, I would say the awareness has increased dramatically when women come in. Most women are asking about their screening with their primary care providers, and most women, even when it's not Breast Cancer Awareness Month, are thinking about breast cancer.
Perfect. And then the last part of this, I just wanted to ask, is there any progress that's been made on the treatment of breast cancer?
Absolutely. Again, when you're dealing with a cancer that's the most common cancer in women except for some skin cancers, you're talking about a lot of amazing money that goes into research for breast cancer. Again, just in my short career as a surgeon, I've had to change my management in the surgery of breast cancer approximately 5 different times because of the advancements in treatment of both the breast cancer part of it as well as how we deal with the lymph nodes. And so it's amazing that you can see that cure on the horizon.
Excellent. Such important information to get out there. Doctor, thanks so much for talking with us this morning.
You're welcome.
Appreciate it. All right, we'll send things over to meteorologist Katie Alexander for a look at that forecast as you head out the door.
Yes, today is going to be similar to the last